Can you fix a hiatal hernia without surgery? Well, if you go to your GI doc, he'll tell you no. He'll give you some awful answers. Their solution is surgery to fix it. Have you looked at the results after? I mean, have any of you? Just go on Reddit, go on Facebook, go on social media, and ask people how they feel. Don't ask somebody that's had it in the last year or two. Ask people, and you'll find people that have had it for months and then had a relapse like a month later after the surgery. But go and ask people 5 years post-surgery how they're doing. You are rarely going to find somebody that's still doing really well with no acid reflux or GERD. The surgery is not the solution. And I've gone over tons of videos on the surgery. Please, if you're interested in the LINX surgery, watch that video. I discussed the LINX surgery. If you're interested in the Nissen fundoscopic surgery, I'm not sure why, but any of these surgeries, go and check out that video I did on Nissen fundoscopic surgeries and the epic high failure rate. Okay, surgery is not the answer. Now your stomach, if you understand what a hiatal hernia is and what they're trying to repair surgically, the stomach herniates up through the diaphragm, and for some people it's more, for other people it's less. Now if you have a type 3 or 4 hernia, hiatal hernia, then you need surgery most likely. Okay, but if you have a type 1, which is 95% of the people out there with acid reflux and GERD, you don't need surgery. Please don't get the surgery. Please stop. Think about this for 1 minute. The reason you have the acid reflux and the GERD is the stomach herniates up through the diaphragm. There's a little hole called the hiatus in the diaphragm, okay? And it's supposed to turn from stomach to esophagus and slide right up through there. But now the stomach kind of gets up into that hole and you got a second stomach above the diaphragm, right? All you need to do is pull that stomach down. It's not difficult. In fact, it's the easiest thing I do here in my practice. I've been practicing for 25 years. When a patient comes with a hiatal hernia or headaches, especially or sciatica, and I'm like, this is gonna be an easy case. I deal with it all day, every day. It's easy. Trust me, this is a safe, simple technique. And it just makes common sense. The stomach herniates up through the diaphragm. This is what causes the acid reflux and the GERD, because the lower esophageal sphincter is compromised and it can't keep the acid in the stomach where it belongs. So now, by pulling that stomach down, it's very safe, very, very safe. You can correct the hiatal hernia. So my question was, can you correct the hiatal hernia? Yeah. Can it come back? Yes, it can come back. Stress. Building up abdominal pressure, forcing out a poop when you gotta shit and you can't shit, when you're constipated, right? All of these things make a hiatal hernia reoccur. Picking up your child without, bending properly, bending at the waist, dropping the diaphragm down, sitting in front of your computer and slouching as the day goes on, okay? I did a video on a great tip for you guys that sit at a desk that have hiatal hernia and sit all day. It's a towel that you roll up. It's a short. Check out the short videos we've done on hiatal hernia in our playlist. You'll see it there. It's a great tip. But it can be corrected. Can it be cured? For some people, it may never come back. But it's not about curing it. It's about fixing and pulling the stomach down so you don't have all those nasty symptoms from a hiatal hernia, and it can be done. And I'm the only one that has a patent on a device that specifically is made for this. Now, I've been practicing for 25 years doing this by hand, but during COVID, I realized that so many people all over the world were suffering thanks to YouTube. And once I realized that, I felt like I had to do something to help people because it's so simple. In my office, these are the easiest patients to deal with. And I'm not belittling people with a hiatal hernia. I'm not I'm not setting them aside and saying, oh, this is simple. I get it. It's complicated for you. You've been dealing with it for years and you're miserable and you're irritated and you're not getting the answers that you want. GIs are not trained in this technique. Osteopaths are, and very, very small subset of chiropractors are. So instead of trying to find a chiropractor that does this technique, or just finding an osteopath in America is hard to do, just go to refluxshield.com. It's safe. It's akin to getting a stomach massage, and you can control how much pressure you're using with it. It comes with directions. It's safe. Otherwise, I would have needed FDA approval for this device. So please, if you're still suffering and you want to fix your hiatal hernia, go to refluxshield.com. Thanks for tuning in. Thank you guys so much. If you got anything from this video, or even if you just like this view of the Empire State Building and the Chrysler Building, give me a like and don't forget to subscribe. Appreciate you guys.